Hello students, this is a lecture for head and neck anatomy on the bones of the skull, and it is chapter 2 of your textbook. The skeletal system is formed by bone and cartilage. Bones are mineralized connective tissue that function to serve as the mechanical basis of movement and to protect vital organs. Cartilage is semi-rigid connective tissue and is not mineralized. Protection of the vital organs, structural support for the body, and they also serve as a storage site for calcium and blood cells. Compact or cortical bone is made of dense layers of bone cells called lamella. Spongy bone, also known as trabecular or cancellous bone, is made of thin plates of bone cells surrounded by a matrix called bone marrow, which consists of fat and blood-forming tissue. Sutures are fibrous joints that tightly bind the bones of the skull together by means of a thin layer of connective tissue. The gomphosis is a specialized joint in the oral cavity which attaches the root of the teeth to the alveolar bone. The connective tissue that binds the teeth to the bone is called the periodontal ligament. Cartilaginous joints are held together by cartilage. The difference between asynchondrosis and asynostosis is that the synchondrosis represents the cartilaginous growth plate between the bones. Once the bone has stopped growing, the cartilage is replaced by bone, and the joint is then called asynostosis. Another cartilaginous joint is the symphysis, which is a fibrocartilage disc which joins the bodies of the vertebrae. In addition to joining the vertebrae, another function of the intervertebral disc is to act as a shock absorber. The synovial joint is the most abundant joint in the body. It is fully movable, and the bones are held together by a fluid-filled fibrous capsule, which is reinforced by ligaments and lined internally by a synovial membrane that secretes a lubricant known as synovial fluid. The articular surfaces of the bones are covered in articular cartilage. The cranial vault or neurocranium surrounds the brain. It is formed by 4 single and 2 pairs of bones. See the list above. The neurocranium is divided into the calvaria or skull cap and the cranial base upon which the brain rests. The facial skeleton or viscerocranium defines facial appearance. It is composed of 8 named bones, 2 of which are not paired. The mandible is formed by the fusion of the 2 mandibular processes during embryonic development, but it is considered a single bone in the adult. Take a moment to look at figure 2-9 on page 25 of your text and identify the structures listed in this slide. Also have a skull that you can identify these structures on as well. This is a lateral view of the skull. Take a look at page 27 of your text and identify the structures listed in this slide. Refer to figure 2-11 on page 29 of your text to identify the structures shown on the posterior view of the skull. This inferior view of the skull is seen on Figure 2-12 on page 30 of your text. Be sure to identify the structures listed in this slide. This is the inferior view showing the sphenoid bone. It is on page 37 of your text. Be sure to take the time to identify and recognize and become familiar with all of the structures in these slides. On page 32, you will find an internal view of the cranial base. Take a moment to study these landmarks and become familiar with them. Page 32 shows the internal view of the ethmoid bone. Page 35 shows the sagittal view of the ethmoid bone up to the medial wall of the nasal cavity. Take a moment to look at page 35 for the sagittal view of the ethmoid bone. This image shows the anterior view of the maxillary bone, which is found on page 36 of your text. Be sure to identify the structures labeled on this image. This is the lateral view of the maxillary bone found on page 38 of your textbook, showing the maxillary tuberosity. This image on page 37 of your text shows an inferior view of the hard palate. This is page 39, an anterior view of the mandible. Notice the mental protuberance and the mental foramen. Page 39 shows the lateral view of the mandible. Be sure to become familiar with these images and the structures that are shown here. Page 40 shows the mandible from the medial surface. This is an image shown on page 41 of your text of the paranasal sinuses. Those are the sinuses that are around the nasal cavity. This is the frontal, ethmoid, sphenoid, and maxillary sinus. Be sure to review this video with your textbook and a skull to become familiar with these structures. This concludes this lecture on Chapter 2, Head and Neck Anatomy.